Well, Dr. Pierson, here we are at the conclusion of the second annual GANDAID UK conference. I should firstly start by saying welcome back to these shores. So good to see you.
Happy to be back.
Your thoughts on year two?
Well, I thought year one went fantastic, and I think year two went fantastic, and with a very nice, relaxed vibe. Lots of families knowing each other, getting to see each other as if they're old friends. Well, they are old friends. And, you know, the nice thing is some of the aspects of what we're learning about GAN, they're grasping better and more. So the feedback's been great. I've been very happy, and I think the families have been super happy.
That's certainly been the responses I've heard. For people that are seeing you and hearing from you for the first time, can you explain your role within the GAN community?
Well, I was one of the first researchers who was looking at the clinical aspects of GAN back when I met a patient in Los Angeles in 2016. And then I was kind of approached by about 5 or 6 families in the United States who were looking for a researcher or sponsor. And at the same time, I was looking for a research project, and I was approaching them. And so it worked out perfectly for everyone involved. And since then, I have set up collaborations with Juan Young, who's a researcher in Miami who works with mice. I've set up my own research using induced pluripotent stem cells to model the disease. And I've also reached out to groups in England and also in Australia and other places to try and set up a goal of producing clinical research that gives us answers towards things we need to worry about, whether there's issues beyond the brain and heart valve issues that we know about, to looking at what happens in different types of mice or in our stem cell models.
Okay, as I said, this will be a valuable resource for people, particularly we've seen some new faces this year at the GAN conference, people that will receive the diagnosis for the first time. And there's not a whole lot of literature out there. So if I'm a parent and I've received this diagnosis about my child, can you explain to me in as simple terms as possible, what is GAN and how rare is it?
Well, when it comes to rarity, there's only 500 known cases in the world. And we've got a network that is pretty good at casting the net to find people. So if you've got a new diagnosis, you can look for the website for GAND UK, or GANDAID UK, as well as the Helping Hands for GAN group in the United States. There's also a group called ADAGAN that's developing in Spain. There's a group developing in Germany. So there's lots of groups out there. And those people will invariably point you towards myself or a couple other researchers around the world. Now, what GAND is, it stands for GATA-D2B, which is the name of a gene, associated neurodevelopmental disorder. And it's a neurodevelopmental disorder, which is a situation where children have steady progress in their development, but that development is not reaching the same milestones as a child who may be going through typical development. GAND is a disorder that primarily affects the nervous system. And so within the nervous system, the children can have problems with speech as they're getting older and feeding when they're younger. Those are the 2 big issues that pop up. Some of them can have some heart valve defects, so we always ask families to get their doctor to send them to a cardiologist just to see if they have those. And then some other families, or some other children, actually a majority of the children may have some issues with amblyopia or esotropia, where one of their eyes might be a little disconjugate.
How does it affect the brain?
Well, initially what happens is the brain starts off with just a few cells, and those cells have to divide. And as those cells are dividing, they become differentiated into neurons or glia or other types of cells that are going to make up the brain. And to do that, the cells have to kind of undergo this very complicated dance or choreography to go from a few cells to something as complicated as the human brain. And in general, I look at the cortex of the brain. And to form the cortex of the brain, you really need to have different cells getting turned on into different types of cells where they have a neuronal identity. And what happens in GAN is that the division of the cells to set up the timing gets a little thrown off, and then eventually things just get out of sync. And so you get structural changes at kind of a microscopic level when it comes to the cortex, as well as changes to the projections where the neurons are sending their wires.
You've touched on some of the characteristics from your research, and we haven't got the law of large numbers in our favor here,
right.
So people probably need to understand that we're dealing with a small group of people, right. So it can skew results. Right. What would you say, though, are coming forward as the main characteristics for children or individuals that have been diagnosed with GAN?
Right. So I would say the first thing a lot of people will notice is a large number of the kids have macrocephaly, meaning they've got a large head. Now, that doesn't mean they have a large brain, but their head is a little bit above average in size. They tend to have problems with oral mechanical coordination, meaning feeding, generating speech, swallowing, that sort of thing. Those are two of the big aspects there. The next thing is they all have a degree of intellectual disability, and some of them may be more on the severe end of the spectrum and others on the less severe end of the spectrum. Most of the children are hypotonic when they're born.
Which is?
Where they have low tone, which means they might be a little looser, or when you hold them up, they might not be quite as
rigid or robust.
Yeah, exactly. And as they get older, that hypotonia stays around. And some of the children will have issues with coordination, where when they're walking, they're a little bit more unsteady. They're able to walk, and many of the children develop their ability to walk around 3 or 4 years of age, but they might not get that nice, smooth, steady walk until they're much older.
Okay. If a parent is seeing some of the characteristics that you've described in either a young child or a child that they haven't had a diagnosis for, what would your message be to them to bring to their GP or bring to a doctor that they know?
Well, I think the biggest thing is the sooner you can figure out what's going on genetically, the sooner you're going to be able to start, one, becoming a community like we saw today, and two, understanding what's ahead. Now, we still have, like you said, we've got one paper with 50 and another paper with about 15 and a few other papers. So right now, I think there's about 90 patients, probably less than that, who've been reported. We're about to come out with another manuscript of 50. So of the 500, we're probably going to have about 150 reported in the literature. It's still a small number. And so what needs to happen is the GP needs to kind of advocate for the family to get the genetic testing done. They also should be advocating for the family to get into early prevention programs, early prevention programs like physical therapy, occupational therapy, speech therapy. And they need to start looking into maybe going to see a neurologist or something like that. But getting a genetic diagnosis is the key. And almost every country in Europe and North America now understands that exome sequencing or genome sequencing is the first step in that evaluation.
That'll be a great first step for them.
Yes.
In trying to understand the range of severity here, how would you explain that to parents of children that have just received a diagnosis?
Yeah, it's hard to predict who's going to be more severe or less severe. And part of our research is to try and look at the obvious factors that make one child a little different than another. One of our studies that we're about to publish is looking at the type of variant, whether it's a nonsense variant or a missense variant or a frameshift variant or a splice site variant, as to whether that might be causing a difference in severity. We don't really think it is. From what we've seen, seems like most of the children who have a GAN mutation or a GAN variant have pretty much the same sort of range of presentations and all. So then the next thing we look for is perhaps there's proteins that are interacting with the GATA-D2B complex, and maybe there's little variance in those. Now, we don't have the ability these days to look that close to see what might be changed a little here or there, but that's kind of the idea. And there, you might come across a concept called genetic background, which means some people have variants in things that make things better, and other people have variants in other proteins that make things worse.
Okay, I think we could translate that into practical advice, because my understanding is, what you're saying to parents is, look in the community, see the range. You can't automatically assume that your child will hit that or that level or that level,
Right.
but just get an understanding from the parents
Yep.
as to what their kids have, what characteristics their kids have, and how you may then deal with it.
And the first thing I always tell families is, you let your child show who they are. I can publish a paper with 50 kids in it and show you a range, but that doesn't mean your child is going to fit in that. And it's very important to recognize that and not pigeonhole your child into having all of these issues that other children have that they may never develop. Now, it also could be the other way, where your child has other issues that other children don't have, and you don't want to ignore those because, it's not part of GAN. You need to take every child as an individual and evaluate them like that, but at the same time, don't make decisions for them when it's obviously right in front of you what's going on.
I think that's a crucial point. Have a strong understanding, but loosely held idea of what maybe lies ahead for your child, because
the whole point of this is to guide you and provide you clues about what might come down the line. Some children get seizures when they're younger. Some children get seizures when they're older. Some of them grow out of them, some of them don't. It's really hard to tell one thing or another. And
be aware instead of alarmed.
right, exactly. Prepare yourself for it. When you have a plan, it's much easier to deal with something than when everything becomes a surprise and a crisis.
Okay, research is front and center in your life, in your professional life. Is there hope for a possible treatment for GAN?
Well, in my mind, when you have neurodevelopmental disorders, the issue starts during the pregnancy. And right now, we're not looking for these disorders with amniocentesis or other studies that are happening during pregnancy. And so for me, the issue is we're not going to be able to cure GAN unless we can get back and make sure that choreography goes well. Now, it could be that we can find some things that will modulate GAN. And the important thing there is figuring out what's the risk-benefit ratio in that. If it's giving a drug that is well established out there that other children have taken for another medication, another disorder, that seems very low risk. If we're talking about doing very complex and perhaps risky procedures to get a minimal gain, to me that's something that I don't think I personally would do.
Okay. There seems to be a dual message here, that you're encouraging the parents to understand the disorder, live their lives with their child and their child's particular characteristics, and at the same time trust that there is being work done in the background to better understand this without any promises or guarantees of cures or treatments.
Correct. But at the same time, we know so much more about GAN than we did 10 years ago. We understand how GATA-D2B works together with a bunch of other proteins to form this complex called the NERD complex, or the nucleosome remodeling and deacetylase complex. And we've understood that disorders that are in NERD tend to be very similar to GAN. And so perhaps we can learn a little bit more between those and all. But it also allows us to set up models for GAN to say, hey, and even understand NERD, which there's not a lot of information about that out there. And so the next thing you know, we're opening doors to not only understanding the disorder, but actually understanding just how does a brain get formed? How do we, set up all this? It's extremely complicated, but the first thing you have to do is find places where you can open a door or a window to say, hey, this is the next step in all of unraveling this mystery.
Final question, one without notice. How does a man feel who spends his professional life researching this disorder? How does he feel when he spends a weekend amongst these families and these children?
To be honest, it's really gratifying. And you guys are very relaxed. And so that makes me very relaxed. So I feel like I can talk to you guys about the clinical research or the basic science research. And if people don't understand, they're going to come up to me afterwards because I feel like I'm extending a hand and saying, hey, if you have a question, I can try and answer it and all. But it's really nice when you see a community being built and you're a part of it, And that's what's happening here. The GAND-Aid UK group, every year getting a little bigger, a little more families and stuff like that. And it's really important to have that community. And I think all the families that were here this weekend are walking away feeling the same way.
Dr. Tyler Pierson, on behalf of the wider GAN community, thank you for everything you do.
Of course, Brian. Thanks for you.